Yes, and I'll call the meeting to order at 4:08 p.m. Thank you. Our first, I don't actually have the agenda in front of me. I'll have to get it. Uh, there we go. So we'll proceed with the land acknowledgement, and then we'll move to the mission moment. So is the person who's going to do the land acknowledgement here?
Actually, Rena has a job interview, so she's going to be coming in just a little bit late. She sent a message out earlier.
Oh, that's excellent. Okay. So does anyone else wish to do the land acknowledgement? Okay, but I can do it. Is there a slide with the text of the land acknowledgement on it? There we go. Okay. Yeah, so I'll just read this. The Anchorage Coalition and Homelessness and the HPRS Advisory Council would like to acknowledge that we gather today on the traditional lands of the Dena'ina Athabascans. For thousands of years, the Dena'ina have been and continue to be the stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovations, and contemporary perspectives of the Upper Cook Inlet Dena'ina. Okay, next we'll move on to the mission moment. That's you, Julia.
It is. Hi, everybody. Julia, they, them. I am a community volunteer. Glad to be on this advisory council. Susie was going to do the mission moment, but I was asked yesterday and I was excited to be able to talk to you briefly about the Youth Alaska Action Board on Housing and Homelessness and the work that they've been doing. I know that it is not specific to Anchorage, but half of that youth board is made up of young people that do live here in the Anchorage area. The Youth Alaska Action Board on Housing and Homelessness is made up entirely of young people with lived experience of homelessness. Some of them are still dealing with housing instability. There are many young people from all over the state that are part of that action board, and they do the great work in this community of building systems that work for young people in all of our regions of Alaska who are experiencing housing instability. I wanted to lift them up for two reasons. One is a call to action. The YABS funding is about to zero out. They are very motivated and they've applied for some very large grants, but they don't really have the budget to wait and see whether they happen to be granted any of that money. But the reason that I mentioned that specifically, and I'll put their email address over there so that you can reach out to them if you would like to help support them or know of other people who would like to help support them, is that I'm working on the national stage these days in youth housing and homelessness. And youth boards around the country top out at about 3 young people, and the turnover is really significant. And those young people tend to get burnt out pretty quickly. They're also often not in decision-making positions. They're there mostly tokenized as a rubber stamp to things that other people have already decided for them. But guess what? Not in Alaska. Our young people are motivated. They have organized this board all on their own. It's been about 4 years in the making to get it to the robust standing that it's at right now. And they are a guiding star for young people working in youth housing and homelessness across the country. So many cheers to that mission of centralizing the voice of people with lived experience and people who are currently experiencing our systems and making sure that they get to make the final decision about all of these systems. And I'll put their email over in the chat.
Okay, thank you, Julia. Does anyone have any questions for Julia?
It's not a question, but I just wanted to say that Foot is one of my favorite humans ever. And I absolutely love YAB, and everyone should support YAB.
And Rena's on the YAB too, so one of our very own advisory council members.
That's great. Okay, thank you again. So we'll move on to the consent agenda. And how this works is if you have any objections to approving the agenda as is, or you want to change it, or you want to change anything in the minutes, speak now. Otherwise, I'll ask for a motion to support the consent agenda.
I'll second. It's Dave.
Okay,
Mayor.
so it's moved
I can
by-
motion first. I'll motion first.
Okay,
Agree.
moved by
That's Grace.
someone, okay, and seconded by Dave to approve the consent agenda. Is there any objection to approving the consent agenda? All right, seeing and hearing none, the consent agenda is approved, so we'll move on to the advisory council chair report. I actually should have made a motion to amend the agenda because I'm not prepared to give this report on behalf of Allison. So I think perhaps she will come later. If not, we could well, I think I'll just ask if there's any anything any of the committee chairs wish to say at this point. Give a report or something like that.
Thanks, Sharon. This is Julia, they, them. I'm the chair of the Coordinated Entry Committee. I won't give you a full report from what our committee has been doing, but you will have noticed that earlier today I sent out a letter of recommendation from the Coordinated Entry Committee advising this council that we should be paying attention to prevention work within our system. I would like for you all to please take a peek at that. We don't need to discuss it at this meeting, but it would be great if we could put it on the agenda for our, what is that, May meeting. And as always, you're all welcome to come and join us. We meet the first Friday of the month, 11:30 to 1 p.m. on Zoom.
Okay, thank you. Any other committee reports? Or updates? Okay, you know what? I'll give one on behalf of the data committee. We met last month. We were trying to go to hybrid meetings and it didn't work out, and we were a couple of us meeting in a coffee shop with which they're surprisingly loud. So it was difficult. But anyway, we're continuing to work on the metrics for the anchored home plan, and so we put together a list of them, and then we talked about so how we would operationalize each of the metrics. In other words, how would we measure it, and what is the data source for those the data that we would need? Do they either are they in existing accessible data sources, or will we have to perhaps collect some original data? Yeah, and so we're going to continue to work on that. The other thing is that we talked a lot about the hybrid meeting situation, and I think we do want to continue with that, but it's difficult because when we meet on a Wednesday is a day that the coalition's offices are generally closed. So we decided that we're thanks to Laura's great offer of hospitality, that moving forward, the folks who want to meet in person will meet at the NeighborWorks Anchorage, NeighborWorks Alaska building on Fireweed, and then those who wish to continue to meet online, we will have a hybrid option. And there's actually, I'm on the board of NeighborWorks Alaska, and one of the great things is that there's an owl, so it makes the hybrid meeting really optimal. So that's our plan moving forward. Any other committee updates? Okay,
I'm a
then.
member of the compliance committee, but not the chair. We're still our next meeting will be to provide edits for our governance charter as a committee.
All right, thank you very much. Right. Okay, good. So we'll move on down the agenda. I'm going to skip the general updates. We'll move on to the Anchorage Coalition and Housing report and homelessness. Excuse me, not end housing. It's been a long day. Sorry.
Thank you. I know everyone in here. Jessica, her, the Chief Operating Officer for the Anchorage Coalition and Homelessness. I'm going to run through these updates fairly quickly because one thing I really want to make sure is part of this conversation that I bring forward today is that Right now, well, I'm going to do the regular update first. I'm sorry. This has been a week and this has been a day. Government updates at the municipal level, we had been following pretty closely, and I'd been reporting on a lot of the changes that were being proposed regarding abatement code changes, particularly a resolution brought forward by the mayor that would actually bring a new criminal charge for essentially existing butt camping, regardless of whether there was shelter space available. If there are changes to the precedent set with Grants Pass and Martin v. Boise. So all of those resolutions ended up failing at the assembly level. The only thing that passed were two measures, one that would allow a registration process to be developed so that a safe parking space could be developed on private property. So if a business or a church or a nonprofit wanted to put forward their property to be a safe parking space, it set a process to apply for a permit to be able to do that. The second thing that was introduced by Representative by Assemblymember Bronga would take that kind of similar tact, but also allow tent camping. So up to 3 tents on any business, nonprofit, or church property. According to code right now, if you have a private residence, you can already do that. So it is not illegal for you to allow someone to tent camp on your land. But this would extend that ability to business owners, nonprofits, and churches. So look for some communication from the health department over the next couple weeks on that particular process. If your organization, your church, or an organization you're affiliated with would be interested in doing that. At this time, there isn't any financial incentive or financial payment that could go along with that opportunity. But I think that as we move forward, if that turns into a viable solution and those organizations have barriers to providing those services because of finances, I think that's something that everyone would be open to having a conversation about. At the state level, I'm really excited to share that the $4 million, which would be extending the operation of the shelter on 56th Avenue, which is currently providing shelter to 200 people. The funding to continue that shelter's services throughout the summer has now made it into the House budget and the Senate budget. So if it survives the Senate floor, and then survives any budget conference committee that might exist, it would go to the governor, and then would need to survive the governor's red pen, and then would be $4 million for us to maintain those shelter beds throughout the summer. So crossing fingers that can make it through. Meg is down in Juneau well, she left around noon, and she's down in Juneau this afternoon, this evening, and tomorrow, doing lots of different advocacy, but I guarantee you that's going to be conversations that is coming up down there. And then at the federal level, this isn't really a government funding update, but I'm sure a lot of you are aware that the Supreme Court heard oral arguments on Monday for the Johnson versus Grants Pass case. Oral arguments went for just under 3 hours. It was really interesting to hear some of the different perspectives, and really sad to hear some of the different perspectives. But I think that we're all anticipating that any ruling will come in June at the end of the Supreme Court session. I don't anticipate there being a ruling done outside of that. The kind of general sense I got was that based on the questions being asked and based on what was being presented, it seems likely that this will get kicked back as a state rule, that it will not be a Ninth Circuit ruling any longer. Essentially, it will be overturned and pushed back for states to legislate and individual cities to legislate as they see fit. I will say one really sad piece of, not really information, discourse that happened was this argument that your Eighth Amendment right to not be punished in a way that is excessive seemed to be disputed in these conversations. And one of the statements made was that a fine or a short jail term would not be considered cruel and unusual punishment for a ban on camping. And it really hurt me. It hurt my heart because we know that a fine or a short incarceration can absolutely mean the difference between your existence in a space that is healthy and not. And that can create barriers to housing that follow someone for the rest of their life. So while to someone who is not unhoused, a fine might not seem cruel and unusual, I think that it is completely different when we are talking about someone whose entire existence depends on their ability to stay alive from night to night. So that was not a cheery way to end that, but that was about what I had on a federal level. Everything else seems to be just as dysfunctional as it's been for a while now. Operational updates, excited to share that Ziana, who was a coordinated entry specialist with ACH, with Dakota's leaving, is moving into that healthcare integration director position. So excited. It does give us a vacancy in our CE specialist position. So if you know someone who might be interested in that position, send them my way. I know our website says, fill out this application, send us a cover letter, your resume, all of that jazz. But if someone just wants to talk more about the position, they can always just reach out to me and we can have an informal discussion about what the job even is before they decide if they want to commit to that. And then as always, ACH always encourages and gives preference to people who do have lived experience and expertise. So particularly if you know someone who does have lived experience and is interested in that position, definitely send them my way. I think that's it for what I have for government and operational updates. And then I have a presentation later on in the meeting.
Okay, thank you.
And by later on, I guess I mean right now.
Yes. Are there any questions for Jessica pertaining to her report before she gets into the special presentation?
Thank you for that information.
Of course.
Emily, I was going to say fabulous work on the timing because 4:56 right into the presentation. It's like the agenda was made for you.
I guess so. Okay. See if I can do this right. Sharing my screen in Zoom is always weird to me. All right. So this presentation is going to be a mid-level fiscal year 23 NOFO scoring debrief. I'm happy to go into more detail and will go into more detail at the compliance committee level, but I wanted to make sure we had this opportunity at this higher level to have a discussion about what the scoring of our collaborative application looked like for fiscal year 2023 and how that compared to other COCs around the country and places where we can target improvement going forward. So I want to start off with the COC scoring summary. This is going to show the individual scoring categories with our COC score. And then at the bottom, you can see that our overall application score of 155 out of 200. When you compare that to the overall scores for all COCs, which asterisk does not include bonus scores, When you compare that, you can see that we are higher than the median score for all COCs, but we definitely have some room to improve if we want to get up to the highest score for any COC, which for this last year was 185.5 out of 200. So our 155 was a quite respectable score.
Jessica, the slides aren't advancing. You're on the.
Oh, no. Okay. Shoot. All right, how about that? Did that change?
It did not. We're looking at the screen that is the
Oh,
speak-
not the actual. Okay, you know what? We'll just do it this way. And it'll just be a little bit smaller. Zoom does not like me. So everything I just said, here's the slide that applies to it. So our individual scores, and I have slides where we'll go into detail on each of those scoring categories. Lowest score for any COC, 54.5, highest score, 185.5, median of 151.5, and our score of 155, just over the median score for all COCs. All right, so high priority COC application questions. We don't get a scoring detail that goes into every single question that has points. What they do is they identify high priority application questions where you have the most likelihood of being able to affect your score with what you do. A lot of our score is related to data points, which have our narrative statements don't have a lot to do with how those scores are scored. So you can see that question 1D2 and 1D3 we had full points for. One thing that was really exciting to me was to see full points for the street outreach scope, because last year we did not get full points in that category. So really excited to see that all of the coordination and improvements that we made over the past year to how street outreach works in Anchorage paid off literally in the form of more points. Also excited that our maximum points were awarded for how our projects adhere to Housing First and how we evaluate projects for Housing First compliance. Had full points. So 10D5, rapid rehousing beds as reported in our HIC or in our longitudinal data, full points there, as well as full points, which is 1, for increasing our capacity for non-congregate sheltering. So when our community prioritizes non-congregate sheltering over congregate sheltering, HUD recognizes that that is a more effective form of shelter and awards points to our community. 1D8, full points there as well. And this is highlighting our partnerships with our public health agencies, particularly around the spread of infectious diseases. As we know, the COVID-19 pandemic had a really severe effect on how people experiencing homelessness access shelter and accessed housing services. So points awarded for how our community responded in that way. A space where we have some room for improvement here, 10D, advancing racial equity and homelessness. And what they're looking for here is that you are continually assessing your data, analyzing any racial disparities that exist in your community, and then implementing strategies that address not just racial disparities as a whole, but ones that are very specific to your community. So it's not enough to just say, oh, nationwide, these trends exist and this is what we do. They're really looking for you to dig into your local data and figure out where are those disparities coming from in your community and how can you address that. So we had 6.5 points out of 7. So we are doing some work around that, but there's some room to improve. And then 10D11, oh, you know what? I have another slide after this. 10D11 focuses on involving individuals with lived experience in your service delivery and decision making. And as a sub bullet to that, active COC participation of individuals with lived experience of homelessness. So our application got 4 out of 5 points in that area, but identifying some opportunities for improvement there. And these came from conversations. HUD holds a nationwide scoring debrief where they talk about trends that they saw in scores and categories. So some of these ideas came from brainstorming and discussions we've had locally, and some of these came from that national debrief of what other communities recognized and how they addressed some of these areas on their collaborative applications. So looking at engaging a community of people with lived experience and expertise, which I learned at a recent HUD conference, people are calling PLEE, to advise the advisory council, and ensuring that I'm really excited that Julia mentioned this as well, that they're involved at a decision-making level and included in the development of the local competition rating factors. So how we judge our applications and that coordinated entry process. It's really important that it's HUD is recognizing it's not enough to just say we have people with lived experience involved in our community. You really need to ensure that that decision-making level and participation exists. Making professional development and employment opportunities available, and then routinely gathering and incorporating feedback, and then report back on your steps taken to address the challenges that are raised by people with lived experience and expertise. So involving people with lived experience and expertise at decision-making levels, gathering feedback on where you should make improvements to your processes and your systems, and then actually incorporating that feedback and addressing those challenges. This next section talks about our project review, ranking, and selection. Full points here for how we are addressing any barriers in the application process, in the rank and review process, and then ensuring that we have participation of overrepresented populations in our local competition review and ranking process. And HUD has a pretty strict criteria for how they do that. They're looking for a certain percentage of points to be based on objective criteria, and that a certain percentage are based on system performance criteria. So it does limit some of what we can put in that application in order to be able to get these full points. And as you can see, 21 points is pretty big on this application. So we always want to make sure we have full points. But we do want to, as much as we can, incorporate what our community's needs are when we're developing that application and that scoring criteria. Homeless management and information system bed coverage. So we have 2 different sections of points here. One of them is based on, did we submit at least 2 usable LSA data files by the deadline? There's 2 points available. You get 1 point for each data file that is submitted. And I saw Kim was on. Thank you, Kim. We did submit 2 usable LSA data files by the deadline. Yay, full points. Our bed coverage rate. So looking at our HIC, which is housing inventory and HMIS data, housing inventory count, sorry, and HMIS data. There's a total points of 4 available there. We got 2.5. So there's ways that we can have opportunities for improvement on increasing that number there. So we're looking to have a bed coverage rate of over 95%. And what that means is that at any given time, when we pull this data, that we don't have any more than 5% of our beds vacant. So one thing that we've identified in the past is working with the VA to make sure that we have that information on the VASH voucher data to be able to be included there, since they are not an HMIS participating provider. And then just identifying other ways to increase that bed coverage rate to over 95%. So really working with the providers in our community to help identify if you are a project that does have vacancies that are more than 5%, or quite frankly, any vacancies. What can we do as a community? What can the coalition do as the COC lead agency? What can the advisory council do as the governing body of the COC to help ensure that all of our resources are being used to the maximum extent that they can be? Going to 2C2. So this is based on two areas of information. It is your data that is submitted through HDX into the HUD system, and our narrative response. This is our biggest opportunity for improvement. Reducing our length of time homeless. Our community's length of time homeless is through the roof. The HUD standard for a high-performing COC. So if we wanted to say our continuum of care is a high-performing continuum of care, that length of time homeless needs to be less than 20 days. So from the time someone enters homelessness until the time they are housed, 20 days. That is a very low number, and our number is much, much higher than that, like 3 digits high. So there's not a lot we can do on the data side, except for reduce the time people are actually spending homelessness. But what we do get is points on our narrative response as well, where we describe what is our strategy to reduce that time. How are we identifying and housing individuals with the longest length of time homeless, and who do we have in charge of that? So actually identifying someone whose role is that. So I think we have a couple different opportunities here that we can focus on in a short term. We can work to create new housing units. When housing units are available to people experiencing homelessness, it doesn't necessarily mean that it is a brand new unit somebody built. It might be a unit that exists with a landlord who in the past has said, I don't think so. And now we are approaching them in a different way with different resources to be able to say, we can help support this person in their permanent housing. So landlord, it's worth you taking the risk with us and then proving through our services that it was worth it. And then last, developing strategies to reduce that time between that referral being issued and that client being housed. Because we know that if we have prioritization factors that are prioritizing people who have highly vulnerable statistics, such as multiple disabling conditions, and then also people who have been experiencing homelessness the longest, that's like the next level after disabling conditions. If we can then reduce the amount of time between that referral being issued and that client being housed, that will also reduce the time that they spend experiencing homelessness. So those are two things that can be highly impactful, that are fairly low effort. Moving to returns to homelessness. So this is another place where HUD really weighs this pretty highly. And we do have opportunities to improve our score there. We received 7 out of the 8 points. And again, this is based on the data that we submit in terms of returns to homelessness, as well as our narrative response to what is our strategy to identify people who return to homelessness? What are our strategies to reduce those rates of returns to homelessness from our programs? And then again, who's responsible for overseeing that? So in closing, we're talking about debriefing this NOFO while also preparing for the next one. Our 2024 application, we don't have a release date yet, but I'm anticipating about the same time frame as it was this last year, so late June, early July of this year. If you're an existing grantee, watch for an intent to renew form. We want to make sure that we know prior to the NOFO release, if we have providers in our community who are existing grantees that don't plan on renewing their grant. So we want to get those forms out and get that information in so that we can start working to develop the application and working with the compliance committee on the criteria that we want to put into that application and the questions that we want to ask outside of the kind of HUD mandated questions. So that was a lot of Jessica talking. If people have specific questions now, I'm happy to answer them. Also, happy to sit down in more detail going forward and talk about strategies that we can go. And yes, I see Julia's note. I agree. Evaluation of CE, it's a big part of this. And we really have to know if what we are doing is effective and it's meeting the needs of the community. I think that when we talk about advancing racial equity, when we talk about reducing the length of time homeless, if we don't have an effective coordinated entry system, everything else we do doesn't matter at that point. So agree with that completely. I'm excited for the next committee meeting because I have some ideas from some HUD training I went to. So they had some pretty cool tools.
All right, now I'll say on behalf of the data committee, please consider involving us in those conversations.
Yes.
This may be something we can help with if it's not outsourced or anything like that. So.
Not outsourcing it this year, so.
Okay. Good. Yep. We might be able to help, or members of the committee might be able to help.
Yeah, I just am not sure that ACEH can immediately say we're not going to outsource that this year.
True.
So
True.
we're going to have some more
There's
conversations.
not plans to outsource it this year, but yes.
Well, I mean, ideally, there would be a mechanism to just sort of conduct a routine evaluation. So it's not a big project all the time, to do it. It's just sort of, yeah.
Yeah.
Everything's a work in progress, continuous
And I guess maybe I
improvement.
should have specified, I meant no plans to outsource the collaborative application this year. Not necessarily CE evaluation, if that's
All right,
where
okay.
that question was.
That's what I was referring. Yeah.
Okay.
When I said outsource. Okay. Thank you. All right. So now we're actually on schedule with the agenda. Next we have, are there any questions or comments from anyone here? Either you wish to speak out loud or put them in the chat.
So I sort of have a comment. It could have been part of my report, but I didn't necessarily want it to look like it was part of ACH's report. It's really information to share with the advisory council. But right now is the time frame to start talking about our AKHMIS budget and strategy for our contract next year. So last year, the advisory council made the decision to name ICA as the HMIS lead. So they've been working on transitioning the grants that exist over to them. So the upcoming, the HUD grant and the upcoming AHFC match grant moving over to ICA to go to them directly. But what that is doing in our planning that we've been having, so our planning meetings with Balance of State and Anchorage, has identified that there's a gap in funding for AKHMIS in the upcoming year. So over the last couple years, there has been funding through ARPA, funding through the CARES Act, and funding through an ERA grant that the municipality had available, or ESG, sorry, grant that the municipality had available that was able to help supplement that HUD and AHFC money to support that contract. But I'm not aware of any opportunities at the municipality for any additional COVID funds, either there's no CARES Act money anymore, but any ARPA funds that are unallocated or anything going forward. So Janae was not able to attend today, but she knew that this was due for discussion here. And so just wanted to share that I'm just going to read this from her email. For the next grant cycle, which would start July 1, AKHMIS has been awarded $382,075. And the total revenue that was awarded for this current year was $780,824. And the budget fully funded for the upcoming year with all of the existing current capacity would be $819,865.20. And so per the COC interim rule, and some of this will be discussed at tomorrow's retreat as well, when we talk about the different roles and responsibilities and what is a COC. But the COC interim rule puts the responsibility for funding the HMIS on the COC and the HMIS lead. So I wanted to put that out there, that is where we're at with the AKHMIS funding. It's essentially, it's short money. So looking for ideas or strategies that you all might have for ways to close that gap or ways to identify funding sources that might be available for that. Oh, and I see Laura has her hand up.
Hey, so I know, it probably wouldn't help with this upcoming grant year, but since we're going to be entering into the NOFO season, I'm wondering if we can talk with all of the COC recipients and try to get an HMIS fund through, through each one of our individual COC grants. So that's kind of what we used to do. We used to set aside a certain amount for ICA, HMIS through each one of our individual COC permanent supportive housing or rapid rehousing grants. So I wonder if that's something that can be talked about before NOFO comes out and see if the recipients can work it into their budget.
That is a great idea. That is one of the strategies that other communities have used in both ways, either carving out portions of program grants to help support HMIS or increasing the HMIS grant, because the HMIS grant is just a project in the COC like project pool. And so essentially achieving the same thing by reducing the project grants and increasing the HMIS grant. So that's a really good idea to pull together a meeting of COC grantees and talk about that strategy as well. So I will talk to Janae and look forward to seeing a meeting invite. And I don't know if Kim was still on. Did I miss anything in that, Kim? I know you've been part of the conversations too.
That was all of it. I actually haven't caught most of those conversations, but I think that covers what I know about it.
Okay.
Okay. Yeah, so Sam put something in the chat directing people to the survey for feedback on the vision, mission, and impact goals for the Assembly's alcohol tax funding strategic plan. I just did that survey this morning. It takes like very, very little time. There's very few open-ended questions, so yeah, so that's good. Encourage everyone to do that. I think we can move on to, yes, right. Julia, it's unclear to me which parts of the retreat will include coalition staff and which are advisory council members only. I don't have that answer. I have not been involved really in the intense planning of the retreat. So, does anyone else have any insights into that?
I can just share, this is Jessica, that I plan on being available the entire time. There are some sections that I'm leading the conversation, particularly around anchored home, but also happy to step out and let Michael and the executive committee lead parts of it as well. Very flexible, and APU is right down the street from our offices, so happy to run back and forth as needed also. But I'm not sure there had been detailed conversation about who was facilitating each individual piece. But yeah, the only part I know that it's kind of like tied back to me is the presentation of Anchored Home.
Mhm. Okay. All right, thank you. I think we could move on to good news and community events. Have any good news? Oh, all right. Well, so then our next thing is the upcoming advocacy opportunities. You could read them on this slide. Thank you, as always, our support folks who put these slides together. Really great, very useful information. Okay. Any last remarks anyone wishes to make before we adjourn?
Thank you, Sharon, for running the meeting.
No worries. Oh, Native Youth Olympics. Oh, that's awesome. I always plan to go to those whenever they come, but always bad timing for me. Okay. I'd like to entertain a motion to adjourn if there are no further comments.
Motion, we adjourn.
Okay, is there a second?
Happy to second, but not sure it's necessary.
It is. Any motion requires a mover and a seconder. So thank you for seconding. Is there any objection to adjourning? All right, seeing and hearing no objections, we are adjourned and it is 4:55. Thank you very much.
Thank you,
And I
Sharon.
will see some of you tomorrow.
Appreciate your service, Sharon. Thank you.
No worries. Bye.